Hi everyone, welcome to today's video. My name is Dr. Ray, and today I'm going to be sharing with you my most recent updates that I learned at the 2025 AVMA convention regarding nutraceuticals for joint health in both dogs and cats. What's the evidence, the evidence-based medicine, actual data-driven information on what works and what doesn't work, and what you guys need to know when picking out joint supplements for your pet. So I did a video earlier, which I will link at the end of this video and up here if I can, on supplements in general, considerations to think about whenever you're supplementing pets. Do they need them? How's it affecting the diet? How's it interacting with other components of the diet? And should you be doing it? Should you be doing it at all? And so you can check out that video on a brief overview of just supplements in general. But today we're going to be specifically talking about oral supplements for joint health. And so we're going to call those nutraceuticals. There's a couple of key things before we get into the actual nutraceuticals that you guys need to be aware of. Nutraceuticals are not regulated by the FDA. That means that they can put whatever they want in a bottle and sell it to you, and there's no repercussions for that. So a bottle might say 100 milligrams glucosamine, chondroitin, and there could be 0 in there, and that's completely legal. Is it ethical? No, it's not ethical, but is it legal? It absolutely is, and that happens. And so I'm gonna post here a chart that was shared with me at this particular lecture, and it shows you on the bottom of the chart how price and actual content of the nutraceutical are related to each other. And so if you look at this chart, on the bottom you have price. On the top you have labeled concentrations. And what we're looking at here is, as price goes up, do you necessarily have an increase in the actual amount of glucosamine sulfate in the products? And so as you can see, there were 32 products that they had evaluated. The line across the top, 90%, means it was 90% of what they said was in there was in there. So if they said there was 100 milligrams, there was at least 90 in the bottle. Everything that's down at the bottom is like 0 to 10%. So at the very bottom, you can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17 had pretty much 0, had nothing in there. Nothing that they said was in there. They pretty much could have taken paper from the paper shredder and put it in little capsules and sold it to you, and there was absolutely nothing in there. There were even products that were up to like $4 per pill. As you can see way there on the right, $4 per pill with absolutely 0 in them. And then at the top, the ones that were pretty close, there were 1, 2, 3, 4, 5, 6, 7, 8, 9 that were pretty close but still weren't quite 90%. And then of those 32, there was only 1, 2, 3, 4, 5 out of the 32 that actually had 90% to 100% of what they claimed was in the bottle actually in the bottle. And so what does that mean? That means you have to be very careful. Price, and we talk about this a lot even with diet, price is not synonymous with quality, quantity, or respectability. And so there were diets here that were significantly cheaper, there were supplements here, glucosamine supplements, that were significantly cheaper, but were having the right efficacy, and then some that were significantly more expensive across that gradient that literally had nothing in them. And so when choosing a supplement, it is very, 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 very important that you use a reputable brand. Your veterinarian can help recommend some of those reputable brands. And you need to pick a brand that has the NASC seal. So that is the National Animal Supplement Council seal. It is a voluntary program where they undergo checks and balances to verify that what they say is in the product is in the product. And that is the easiest way to pick a glucosamine chondroitin. So I know a lot of people come to me and they're like, I give a really high quality glucosamine chondroitin. It is so expensive. It's like $4 a pill. That doesn't mean anything. If it doesn't have that NASC seal, you're going to have to request from them data. You're going to have to ensure that that data is third party and not self-reported. And so I highly, highly, highly recommend you choose a product with an NASC seal when choosing a glucosamine chondroitin. Number two, you have to be really careful, again, with price and cost when picking supplements. and you're reading the labels, because you may have product A where it's a little bit more expensive, but you only have to give one pill, versus product B, which is really cheap, but you have to give like 6 or 7 pills. And so actually the cheaper product, if you're giving the proper dosing, ends up to be more expensive, or more costly to you than the more expensive product. So always, when you're doing a cost analysis on these things, you need to take into consideration the amount of pills that you're going to be having to give to get the actual dosing effect on your supplement. Any supplement, not just glucosamine, chondroitin, but any supplement that you are giving. The last thing is safety, and all these products do have safety safety data. There are actually overdoses, believe it or not, that can occur with glucosamine chondroitin. So again, if you're picking a product that doesn't have that NASD seal, yes, you may be getting too little, but there is some data to suggest you could be getting some that are that have too much, and so you do have to consider safety data there. I'm kind of reading through my over 2,200 ER visits in humans are attributed annually to adverse reactions regarding supplements, and the need that we need to make sure that when we're giving a supplement, that we are not overdosing them. So it's very easy to think, well, a little bit is good, more is better. We hear that a lot of things, and that's not true. So protein is a really big one. That was a big fad in pet food, like the more, the better. That's not true, and the same is not true for nutraceuticals. A little bit is good, a lot bit isn't necessarily better. And so a lot of these nutraceuticals do put flavor and palatable things in there to enhance the flavor. A lot of them come in treat forms. You need to actually make sure you put those treats away, because there are instances, quite a few instances, where pets have to go to the pet emergency room, because they got that tasty bottle of supplement and they ate the whole thing and they became very ill. So safety with supplements, yes, you can overdose them, and so that's why it's really important that we're paying attention to what our pet actually needs and following label instructions, making sure we're using one with an NASD seal, and then putting them away, especially if they're flavored, so we don't have an overdose issue on that. So that's kind of a brief introduction to some across the board things before we get into individual joint supplements. So why give a supplement at all? Like, why are we doing that? Why are we talking about it? Why might your vet recommend a joint supplement? Well, the reason is a lot of times with osteoarthritis or hip dysplasia or any of the mobility diseases that affect mobility, we like to use what's called a multimodal approach. And so what that means is we take different things and we take different aspects of veterinary medicine, pharmacology, integrative, supplements, diet, weight loss. We mesh all those things together, physical therapy, and we come with a whole plan. We need a whole holistic approach to mobility disorders in the dog and the cat. And so with that multimodal approach, part of that approach may be the use of supplements. Now, supplements can, if you catch it very early on or you're using them prophylactically, they can improve the outcome in the long term. I do like to say here, as far as supplements, it is important to remember that, again, it's part of a multimodal approach. It's just one piece in the puzzle. I have so many people come in for an annual. I haven't seen them all year, and they come in for the annual, and I say, hey, what's going on? Is everything going okay? Oh, yeah, they're just slowing down. They seem to be a little bit painful in the hips. They have trouble getting up. But I started them on a glucosamine supplement. Glucosamine supplements are not they're not proper pain management. Again, they're just part of a multimodal approach, and that always hurts my heart when I hear that, because for a year the pet probably needed some actual anti-inflammatory pharmaceuticals for their pain management, and a person thought they were doing a good thing. I wish they would have come in and saw me and had a workup so that we could have got on the full multimodal approach plan, because glucosamines alone are not going to stop the majority of pain, or supplements of any kind are not, for the most part, going to stop the majority of pain. They are used in conjunction a lot of times with other pain management options. So if you have a pet that's in pain and you're currently just using a supplement thinking that it is a pain reliever, please consider getting that worked up and asking your vet about a multimodal approach for them. One other thing, and I know this is about supplements, but I want to talk about this because it's over the counter and not necessarily a supplement. There are a lot of over the counter preparations of aspirin. for dogs, and there may be some for cats as well, but mostly the ones I see are for dogs, over-the-counter joint pain relief that are aspirin. Please, please, please avoid these. Do not give your dog aspirin. We do not use aspirin in dogs or cats for pain relief. It is over the counter, so companies can sell them and market aspirin for dogs because there is no regulation on it, but it is not recommended. So aspirin is a non-selective COX inhibitor. It will inhibit a lot of the inflammatory pathways. It also causes issues, or is used for, it's what we use it for in animals, is to prevent clotting. If your pet has a clotting disorder, that's what we predominantly will use aspirin, although we don't even use aspirin anymore. We tend to use Plavix. And so aspirin just is a no good thing for dogs, and it is absolutely toxic for cats. Never give your cat aspirin, but I know there are a lot, and I see a lot of people bring in doggy aspirins, or they're giving a baby aspirin to their dog for pain. It is not a very good pain modulator, so it's not giving your pet very much relief, and it is causing a lot of damage to the liver and kidneys, as well as causing some clotting disorders. So avoid those aspirin over-the-counter pain relief and get your pet in, and we can get them something that is very good, very effective, and very safe. All right, so we talked about some of the ground rule things. Let's get into everybody's favorite, and these are my notes here, everybody's favorite supplement, and that is glucosamine and chondroitin. And so we've known for a long time that glucosamine, chondroitin can be beneficial in pets, and so dogs and cats. I'm going to share with you the information that was shared with me, and at the end of this video, I will put a link to my website where I will link a page on all the references that I am referencing, because the speaker did provide me a whole list of references. So I'm going to, if you like to read papers, I'm going to put that on my website. It'll be free for you guys to download. So if you haven't checked out my website, please do. It is animaldocray.com, and I put a lot of things on there, and this will be on there for you for reference. I actually may link this video as well. But in 2017, a randomized placebo-controlled trial in 60 dogs did show improvement in the canine brief pain inventory score in both the treatment groups and placebo groups, which means that there was no significant difference between them. And so in that particular study, we did not see a whole lot of improvement. And so why do I bring that particular study up? Because I know a lot of you guys are like, what are you talking about? All the vets recommend glucosamine, chondroitin. Yes, they do. But the important thing that I just said, and this is what I want you guys to be looking for on your labels, is I said glucosamine chondroitin sulfate. And so if you look on your glucosamine package, if you have one, pause the video right now and go and grab it. Grab your glucosamine supplement and see, does it say glucosamine sulfate or does it say glucosamine hydrochloride? They sound the same, but they're very different. So based on this study, we know that chondroitin sulfate is not very well absorbed in animals. It has to be the hydrochloride. So if you purchase a supplement right now that says glucosamine sulfate, that's not doing anything for you. It's not doing any better than placebo. And so you need to look for, on your packages of glucosamine chondroitin, it needs to say hydrochloride after the glucosamine. So that was a big takeaway that I had in this lecture regarding the glucosamines. Yes, we know they work. They decrease inflammation. They produce or help the synovial tissue get healthier. The speaker did talk about how we learn in vet school that the cartilage in the synovium, they don't have, the cartilage doesn't have any pain receptors. And so, why is it that, rebuilding cartilage helps with pain? The reason it helps with pain is below that cartilage in the synovium, that is very heavily filled with nerve endings. And so by building your glucosamine and increasing the synovial fluids, you then can reduce the shock and inflammation on the nerve endings there in the joint. And so, yes, glucosamines and chondroitin are good. Yes, you need to follow the appropriate dosing range. But my advice to you based on this lecture, and I didn't even know this before, you need to be looking for a hydrochloride and not a sulfate in your glucosamine chondroitin. So that was the big one, the big takeaway, honestly, that I had in this lecture. The second thing that he talked about is the green-lipped mussel. I actually did a video on that earlier and I never published it for various reasons, but the green-lipped mussel, you can find that in powder form or in chews. What it does is it actually is a mussel. It's the Perna canaliculus, and it provides omega-3 fatty acids, glycosaminoglycans, and antioxidants. And some dogs did show some benefit, but the results were kind of inconsistent. And I think the reason why it was inconsistent is the processing is very important. Like, it has to be freeze dried and it has to include like the shell. And if they don't do that, the efficacy is really highly influenced. And so can green-lipped mussels be beneficial? They might be beneficial, but if you're going to use them, you need to get the freeze-dried version, and it has to actually include the shell in it. Omega-3 fatty acids. And so there are lots of studies that do support the use of the long-chain omega-3 fatty acids, and it has to be from cold water fish oils. So that's the key here. They did a study in 2019 using the canine brief pain inventory score, as well as load and force plate analysis, and they found that while all the groups showed improvement, they showed the most improvement with fatty acids if you use them in combination with an NSAID. So an NSAID is going to be like your Carprofen or brand name Rimadyl. That's going to be your Daramax, your Previcox. Those type of things are NSAIDs. So your omega-3 fatty acids work best when used in conjunction with the NSAID, because in that 2019 study, when you use them in combination, that's when you got the greatest reduction in prostaglandins and you had more peak vertical force improvements. The key thing here, also another takeaway on this that you guys can use when you're evaluating your labels for your omega-3 fatty acids, is you want an omega-3 fatty acid that is from cold water fish oils. That is very important. If your label says flaxseed omega-3s are not absorbed in our canine and feline patients. And so you are having very poor conversion in dogs if you're using a omega supplement that is derived from flaxseed. So take away on the omegas. Yes, they work. They work best if you're using, again, that multimodal approach with an NSAID. It needs to be cold water fish oil. And if your label says flaxseed, toss it out. You're not getting anything from that. Another popular one he talked about was the eggshell membrane. I know a lot of pet foods are including eggshells in there. Eggshell membranes are supposed to be rich in elastin, collagen, glycosaminoglycans, but there is mixed results with that. So a 2016 study took 51 dogs, and they did have improved pain scores, but they didn't have any change in mobility. A 2019 study showed lower interleukin-2s, which are inflammatory mediators, but only the load scores includes and not the pain score. And then a 2022 in-home test in 69 dogs showed significant improvement by day 30, but this was owner assessment. And so that's another important thing. And this is not a lecture on how to read papers and data, but since I am going to be linking some studies for you guys to look through, when we're talking about mobility, and I do this all the time when new products come out. So like the newest products to come out for mobility were the Librela and the Silencia monoclonal antibody injections for dogs and cats for diagnosed osteoarthritis. What I asked when I was reviewing the data and literature to see if we were going to bring that product on in our clinic, and we didn't really bring it on. They didn't use force plate studies to determine the success of the product. And so when you're reading these studies, force plate analysis are the best way to determine whether or not mobility is improving. So what that means is if you leave it to the owner, you do it by owner assessment, there is an amount of placebo and there is an amount of variation that's going to happen there. We know that. We give them placebo and the owner say they did great. And it's owner related stuff. And sometimes owners aren't keyed in on some of the cues of pain. So this is a really sad thing too. I have a lot of owners come in, the dog is noticeably lame, they're limping and are holding the leg up, and the owner will say, and I'll say, hey, what's wrong? His leg looks like it's hurt. What's going on in here? They're coming in for something else, like maybe an annual. and they'll say, oh, I don't know, he does that. It doesn't hurt him though. And the first thing that I'm saying to them is, of course it hurts him, because if his leg didn't hurt, he would be walking on 4 legs. And so just because an animal doesn't cry or cry out or lick it or moan or anything like that doesn't mean that they're not in pain. Leg shifting lameness, holding a leg up is pain. And so when we allow the owners to give input and feedback, and we use that as our information for our data for studies, it's really suspect, because what if you have a bunch of owners that feel like 3-legged lameness, as long as they're not crying, isn't painful? That's not accurate. And I'm not saying all owners do that, but there is a absolutely significant portion of people, enough that I'm bringing it up, that will come into my office on a regular basis, say their pet's not in pain because they're not crying, even though they're only 3-leg walking. So yes, if your dog breaks their leg and you touch it, they're going to cry out in pain. But if they have long time chronic osteoarthritis, as an animal, they're going to hold that and they're going to hide that, because it's their natural prey and predatory instinct. So just because they don't cry out in pain, if they're holding a limb up, or there's even that little tiny lameness there, that is a significant indicator for me as a veterinarian that your pet is in pain, and how I determine if they're in pain on physical exam. So that's an important thing to note on judging your pet's pain. So you know, that's how these eggshell membrane studies were, some of them were done, the in-home ones, and so those are not really definitive. So eggshell membrane is kind of like a wobbler. There's not really good evidence there. The one that did show, in addition to the glucosamine and chondroitin, did show a little bit of promise, was the undenatured type 2 collagen. And so what happens with the, and we'll call it UC2, UC2 acts via immune modulation in the Peyer's patches. Those are in the GI tract, and they lead to regulatory T cell development and a cascade of joint protective responses. And so what is undenatured type 2 collagen? That's kind of like where you take like the beaks and the feet and the hooves, like of chickens, and you cook it down, and you're getting that collagen out. Let me reference my notes here really quick, because I think I wrote a little bit extra down about that in my actual notepad. Okay, yeah, so that's, they take the collagen and things like that, and it's the undenatured collagen that we're extracting when we do that. Multiple studies, 2017 to 2023, demonstrated efficacy that was comparable when you use the UC2s to NSAIDs in clinical scoring, load, and biomicro reduction. So we do have some like legit data that may be useful. Notably, a 2022 endurance trial in Labrador showed improvement and decreased inflammatory biomarkers as well. The thing is, he put there, the orthopedic specialist that gave this lecture said that he has issues with compliance being a long-term administration thing with this. I'm not sure where you would grab a UC2, and the dosing is 40 milligrams on that. And so let me do a quick search here. Undenatured collagen, because you wouldn't really be doing this at home because you're not going to be able to quantify. So I actually have had some clients say, well, I just take all the chicken necks and feet and stuff or whatever, and I boil them and I feed them to my animals. There's no way to know you're getting the 40 milligrams in there, or if you're cooking it too much and you're not doing the proper temperature. And so I wouldn't recommend that. Undenatured collagen 2. There's a couple of them. Now Foods, you can get that on Amazon. Yeah, so that one's like only 20 milligrams. So you can find some supplements that have the UC2s in there. So again, if you find a product that has a UC2 in it, then I don't have any specifically that I'm recommending because I just learned about this, so I have to do my own research as well. But I would say, you can absolutely find them on Amazon. So if you are searching on Amazon for a product that contains the UC2s, which seems like that would be a good idea, you want to pick a product that has the 40 milligrams, and that's a 40 milligrams, I believe, across the board, and make sure you're giving it appropriately, because it doesn't work if you do not give it regularly. Other than that, he talked about some other less common things. So fortitropin, which is freeze-dried fertilized egg yolks. There are some studies going on that that shows that after knee surgery, you had some reductions in you had reductions in myostatin increases. Effects on weight bearing and mobility remain underpowered or non-significant, and they need to do some more studies on that one. And then ursolic acid, it targets skeletal muscle and mRNA expression. And although it is interesting, we still don't have enough peer-reviewed data, and it's very limited as of 2024. So I don't know too much. There was not too much information, and the jury's still out on urosolic acid. It is sold by the name Ursolix. So I've never even heard of that. So I have not been using that, and it sounds like not many people are because there's not a lot of data there. And so when you're reading the data, because I'm going to give you guys the data, there are some significant things you want to make sure that you are looking for. So we already talked about force plate studies. You absolutely want to make sure that you are looking for studies that are peer reviewed, so that other veterinarians and specialists have like looked at it and tried to poke holes in it to find out where the shortcomings are and see if it even is valid research. It should be independent third-party analysis. So some of these companies do in-house analysis. That's not what you want. That's why the NASC seal is important, because we want reputable manufacturing processes, and we want to make sure that the dose and the quantity is verified. So we talked about that. That 2000 analysis of 31 chondroitin products found only 6 met the 90% label claim cutoff, and there was no correlation between price and content accuracy. So you definitely want to stick with a product that has that NASC seal. All right, guys, so that was the rundown of the 2025 update from the AVMA convention on oral nutraceutical joint health supplements for dogs and cats. A lot of studies were dogs, but much of this is also applicable to cats as well. I know Cosequin makes a good cat sprinkle capsule. VetriScience makes some chews and things like that. So there are definitely options out there for cats. I believe there is a gel called Joint Gel that is a palatable gel that you can use in cats, so you guys can check that out. Not necessarily recommending products or anything like that, just throwing out some names so that you guys can discuss that with your veterinarian. I absolutely want to thank Dr. Matthew Brunke. He's the one that did this lecture. I think he did a very good job. He was very captivating in his discussion, and I do appreciate his time to give us all this information at AVMA. So I hope you enjoyed this lecture. I hope you will hang out with me. If you enjoy these type of updates, just leave me some feedback and comments. This is one of the first one I've done that is not really a beginner. It's more of an intermediate to advanced topic. So shoot me some comments down below. Make sure to follow me on Instagram. Make sure to go over, because I did do a lot of real life stuff, and you can go and check it out on Instagram about my adventures in AVMA. And then go to my website and check out the references for this discussion. So I will see you guys next time. Be sure to like and subscribe, ring the bell, and we'll hang out again real soon.